I'm Dr. Nikki DS. I'm a surgical breast oncologist. I'm a local, so I grew up in Newburn, but I came home because I wanted to serve Eastern North Carolina. My specialty is breast cancer and breast cancer reconstruction. So I did training for surgery, general surgery, vascular surgery, all types of surgery. But for some reason, breast cancer really drew me in. So toward the end of my career, I started to really focus on breast cancer. And I think the reason why is A, the population. So working with women is obviously the best group of people to work with, but also the end game. So breast cancer is extremely emotional. Our breasts for women really identify or help us identify like our femininity, our social roles. And so when there's pathology in them, there's a lot more involved than just simply going to the operating room and removing the mass. There's a lot of science behind it too. So I feel as though I'm always studying, always learning. There's research out the wazoo, which we have to learn about. And so it keeps me on my toes. But ultimately, I think the most important part is when we're done with treatment. If we've removed all the breast cancer and people are happy with what they're left with, then that's my ultimate goal. So we have multiple things moving right now, which is wonderful for our community. Our hopes are to build a high-risk screening clinic, as well as to build a nationally certified breast clinic here. The first part of that is having a person like me, so a breast surgical oncologist, to kind of move all the pieces around. The other thing we do is very highly collaborative. So we have radiation oncology, medical oncology, pathology, as well as radiology, all working as a team to make sure that women are getting the most up-to-date breast cancer treatment available. After that process, we can move on to breast reconstruction if they desire so, but mostly we're focusing on breast cancer and making sure that this community is served. I approach patient care in the reference of breast cancer and breast pathology in a collaborative fashion, a holistic fashion, and a very integrative fashion. Breast cancer is one of the most highly researched cancers in America. I think now the world has turned to specialization of all treatment of cancers. Here at Enzo Memorial, we have the capacity to have 3 of the most important players in breast cancer treatment that are specialized and trained. So there is no need to go to a higher academic center unless you're a very specific rare case. The majority of breast cancer are not those cases. We are more than capable of treating that here. If for whatever reason we get ourselves into a situation in which you would be better served in an academic center, then all 3 of us would easily send you for a consultation for that. But I would say overall, with trained specialists in breast cancer treatment, there's no need to have to leave Eastern North Carolina. Obviously, if you have any concern in relation to your breast, so breast cancer, masses, abnormal findings, anything at all that makes you concerned or is different, then I would say talk to your PCP or internal medicine doctor. They can refer you over to Enzo Surgical, and obviously I'll take a peek for you. You have to be aware, though, that breast cancer is the most common cancer in women in the United States. And so nothing is too small. I tell my patients all the time, if you think it's silly, it doesn't matter, just call me and we'll take a peek at it and make sure we're not missing something scary.